Hi to all, my name is Melpo Pittara. I'm a Schwannomatosis patient representative at NFPD organization, and today I will present the first clinical practice guidelines for the diagnosis, treatment, management, and surveillance of people with schwannomatosis. So the overall scope was to optimal the diagnosis, clinical management, and surveillance of people with confirmed diagnosis of schwannomatosis. And all these have been done for a cooperation from members of European Reference Network and Genetic Tumor Risk Syndrome. So patient population was all individuals with schwannomatosis, and our goal is to develop our recommendations with clinical overview recommendations, diagnosis recommendation, imaging and genetic specific image surveillance recommendation, annual clinic assessment recommendation, no surgical pain management recommendation, surgical intervention recommendations, and no surgical intervention recommendation. So to be able, the doctors have the holistic image of schwannomatosis patient. So the guideline group was separated in multiple specialties and patient advisory group. So the multiple specialist group, where was the guideline group, consists of 15 experts. The patient advisory group was consists with 4 people. Also, we have a collaboration with core working group to help with the writing of the paper, and also have an extra 11 experts that in Delphi process. So the co-writing group consists of ERN GENTURIS healthcare providers, member of different member states, to have more specific solution for our recommendations. The guideline group consists of clinicians with expertise from clinical genetics, neuroperipheral nerve surgery, dermatology, anesthesiology, neurology, radiology, and also the patient advisory group were affected individuals and their representatives. And the guideline group was led by a core working group, as I said before, of GENTURIS healthcare provider, members of different member states, who are recognized experts in specialized clinical practice in diagnosis and management of schwannomatosis. Next slide. So the method that we following, we found 237 published articles extracted from the digital library PubMed using the following terms. So we was looking for a word schwannomatosis in title or abstract of the scientific paper, and the volume of peer-reviewed evidence available to consider for these guidelines was small and came from limited number of articles, as you can see, which typically reported on small samples. So to balance the weight of both published evidence and quantity of expert experience and knowledge, we have used the following scale to grade the recommendation. So strong evidence is a condition than experts' consensus and consistent evidence. Moderate evidence was experts' consensus with inconsistent evidence and or new evidence likely to support the recommendation. And third, the weak evidence. Also, Delphi assessment was applied. Delphi is a structured communication technique which opinions of a large number of experts are assessed on a topic in which there is no consensus, and it was used as a consensus building exercise. So experts included in this exercise included the member of the core group and the schwannomatosis guideline group and the patient advisory group. The threshold of consensus was defined by the simple majority of the survey participants agree, with a recommendation about the 60% they agree or totally agree. And last, recommendations were graded using the 4-point Likert scale, with totally agree, disagree, agree, totally agree, and certification for the given rating was obligatory. For discussion, recommendations for schwannomatosis patients, one recommendation is for the schwannomatosis in children and adults are distinct from those for children and young adults to the difference in gene-based recommendation, and they need to simplify them. The second was the treatment of pain. The guidelines focus on comprehensive recommendation of treating the hallmark symptom of pain in individuals with schwannomatosis. Third, the surveillance consideration. Surveillance recommendations are made with the aim of not overburdening patients with unnecessary MRI scans, particularly from mildly affected individuals who may produce only a small number of symptomatic schwannomas in their lifetime. For the malignancy of schwannomatosis, malignancy is considered rare in schwannomatosis. However, individuals with germline mutations, the SMARCB1 gene, may have an increased risk of malignant peripheral nerve tumors. So changes in tumors, especially of those causing functional impairment, should prompt evaluation for malignant transformation in individuals with SMARCB1 pathogenic variants. Also, schwannomatosis is distinguished from neurofibromatosis type 2 by the absence of bilateral vestibular schwannomas and epididymomas, and the presence of unilateral vestibular schwannomas is no longer considered an exclusion criterion for schwannomatosis in the absence of proven germline or mosaic neurofibromatosis type 2. Segmental schwannomatosis, characterized by schwannomas affecting one line or less than 5 contiguous spine segments, may have a genetic basis involving LZTR1 pathogenic variants. So surgical resections of tumors in segmental schwannomatosis can provide pain control, but may be associated with a high rate of recurrence. And last but not least, patients with schwannomatosis often experience intractable pain, which can significantly impact in their quality of life. So the recommendations include assessing psychological needs and annual visits to address the emotional impact, including the risk of suicide. So our future priority areas for schwannomatosis is to develop better pain management strategies, address intractable pain in patients, investigate reasons behind the low occurrence of schwannomatosis in individuals with LZTR1 loss of function variants, improve prediction of malignant peripheral nerve tumor risk, develop early detection methods, and clarify overlap for ALIC condition, for example, LZTR1 related nuance syndrome, coughing series, and SMARCB1 predisposition. And last, foster collaboration among researchers and clinicians, and promote multidisciplinary approaches to better understand and manage schwannomatosis, and also a focus on addressing patient needs and quality of life, consider psychological and emotional aspects. That's all. Thank you.